when I was a resident, one of my professors told me that Helen Keller was asked one time about some of the difficulties she faced, and she said that deafness was far worse because it separated you from other people. And so it does. Your sense of sight and your sense of your hearing, those are the most valuable things that human beings have to be able to communicate.
Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, listeners. This is Stacy Wellborn, your host for the Swain Sinus Show. I'm here today with Dr. Swain. How are you?
Great, Stacy. How are you?
Doing wonderful. I was thinking we would go back to a topic we have discussed before and go a little bit more in depth about cochlear implants and hearing aids.
That sounds great, Stacy. Let's talk.
Well, Dr. Swain, this is the Swain Sinus Show, and we've talked a lot about sinuses, we've talked about earaches, and we have talked about ears related to sinus, but do you see a lot of people related to hearing loss, to injury or music or shotguns?
Yes, Stacy, we provide care for people with ear, nose, and throat complaints all the time, and certainly hearing loss, just from having, hearing loss is something that we see a lot of. You don't have to have an ear infection to have difficulty with hearing. I think that's the biggest thing people can take away from the show is that hearing loss is common. It is treated by an ENT doctor, and it's something that, we have good treatment options for.
And I would imagine that based on age, there are different treatment options. So a younger person, I'm aware of this cochlear implant, and obviously it's been a major transformation in this treatment, right? Will you talk a little bit about cochlear implant?
Sure. What a cochlear implant does, it helps someone that has a neural hearing loss. And so if the cochlea is not working well, so let's back up for a second and talk about how people hear. So sound is made. The sound waves travel through the ear canal where they're funneled to the eardrum. They move the eardrum back and forth. That moves the malleus, the incus, and the stapes. And then when the stapes moves, it transmits a signal to the cochlea, which is kind of the hearing organ. And in the cochlea, then it transmitted to a signal to the cochlear nerve. And so in people that have severe damage to the cochlea itself, they can't hear. And so there's a way to provide direct stimulation to the cochlea nerve by putting an implant into it. It's actually an electronic array, and they have a processor that sits on the outside, usually underneath the skin, and sound is conducted through the little microprocessor, through those little fibers, to the cochlear nerve directly.
Wow.
And now they're in kids that have hearing loss and newborns, because after every baby's born, they do a newborn hearing screen. They can offer children under the age of 1 cochlear implantation. Usually that's done at an academic medical center because that's not a super common problem.
Right.
But in adults and elderly people as well, cochlear implant is a great operation in someone that can't hear with hearing aids.
Is that typically a total hearing loss situation?
Yes. You wouldn't do it just for someone if they can get aidable hearing. So the idea is if they have serviceable hearing and you can fit them with a hearing aid to get people to hear better, do it. But if some people, their hearing is so bad they don't get much relief with a hearing aid, there's another option.
So Dr. Swain, when do you start the conversation about using and needing hearing aids?
So it's a complicated issue. I think the simple answer to that question is it depends on what their hearing is like. So usually when people are coming in, it's because either they recognize they have a problem, they suspect they have a problem, or they have a family member who's telling them they have a problem. And so you start that conversation saying, look, depending on what the hearing test shows, you're missing things that you should not necessarily be missing, and this can really help your quality of life. I don't never tell people you have to have a hearing aid because you're not going to die without a hearing aid if you have hearing loss. But it's such a big part of quality of life more than anything else. Now, when children come in with hearing loss, they can't make that decision. There's a parent or a guardian or somebody that's making the decision for them if they have hearing loss. And so, you give them, if it's an ear infection, if they're sent by the speech therapist because they're speech delayed, and they've got chronic ear infections, well, yeah, putting a set of tubes in that kid's ears and getting them hearing normally, that can change their entire life. Their speech will improve.
Right.
Long-term outcomes show that if your hearing well as a child, that will give you multiple benefits as you get older, specifically, being able to speak normally, because children learn to speak
through listening
by their ability to hear. As an adult, you're developmentally grown and you're normal and you've got normal speech patterns. It's really more of a question of, hey, are you ready for this? One of the things that I think is so helpful is when they can have a demo hearing aid, when they can actually sit down and put something in their ear to say,
oh, this is what it should sound like.
Exactly. And so that makes a big difference, because you can tell somebody that they're missing stuff, but it happens usually gradually. And so over the years, they kind of forget what it's like.
Well, they adjust to it, essentially.
Exactly.
Right. And then the rest of us are sitting there blown out by the TV being turned all the way up.
Exactly.
And not having a great quality of life because we got to go in the other room.
Exactly. And that's the thing you mentioned, quality of life. When I was a resident, one of my professors told me that Helen Keller was asked one time about some of the difficulties she faced. And she said that deafness was far worse because it separated you from other people. And so it does. A lot of times there's some stigma associated with having hearing aids. People don't want to be seen as being older or
Especially
impaired.
those that are maybe in their mid-40s that are starting to recognize some hearing loss. There's a lot of embarrassment about having hearing aids.
Some people just don't want to face the fact that, I'm getting older.
It's kind of like deciding you have to need glasses.
Exactly.
There's a point at which you need hearing aids.
Right. And so a lot of times if you can sit people down and say, look, this is what you're missing. Try this and see. This is something that may help you. And sometimes people aren't ready, and we're not trying to give them something they don't want or don't need, especially when it's expensive. But, most of the time it's a conversation. It's a process. People will go home and talk about it with their relatives and think about it. Technology is getting so much better, and there's going to be more and more, different options in terms of cost in the future. We really encourage people not to back away from hearing loss. Something happens to all of us, but there's no reason for this to be something that you should be embarrassed about. There is every reason to suspect that there's, things we can do to get people back on track and living helpful, productive lives. I mean, a lot of times it's safer when you're hearing better.
Certainly.
It makes you a better driver. You certainly can hear things around you. We talked about the fact that you don't want to be disconnected from your family.
Right. Well, I can remember my grandmother wearing hearing aids and them being, large and bulky and filling her whole ear. And it's obvious when she had them in. And nowadays I see people with them and you can see this little bitty clear wire sort of coming out of the ear. And that's all you see. I mean, the technology has changed dramatically.
Yeah. I mean, they're little computers. And depending on your hearing loss, sometimes they have to have a big processor there. I mean, there are some times we don't make, but we suggest people have a larger hearing aid just depending on the type of hearing loss and what we're trying to do.
Mm-hmm. But for those that might be afraid of, let's just call it the vanity of having a hearing aid because I'm not old enough to need hearing aids, there are some that are so small now that they're almost negligible.
Yeah, they're in-the-ear hearing aids, and they can be adjusted with your phone, which is pretty cool.
That's really cool. It's awesome to see how technology changes medicine in general, but specifically in hearing. And folks who are interested in learning more about that certainly could come to your office, try some of the options, and see what it's like.
Absolutely.
Do typically people have loss in one ear or both ears?
It can depend. It just depends on the reason why. If you're older and you're having hearing loss in both ears, we treat that differently than someone that's older that has a hearing loss just in one ear. There are certain tumors that are called neuromas, cerebropontine angle masses, that can grow on the nerve. And anytime an ENT doctor sees someone with a hearing loss that's much greater in one ear than the other ear, it certainly brings up a discussion about whether or not further testing is needed, such as an MRI.
Okay. So if I'm a listener to our podcast and I think I may have some hearing loss, at what point do you recommend I come in to see a doctor?
I think if you're having questions about hearing loss, you need to get a hearing test. It's kind of like a vision test. If you think your vision's going wrong, why wouldn't you get a vision, a test for your vision? It's the same thing. There are lots of places that offer hearing screening tests. Sometimes those screening tests may not be as accurate as sitting someone in an audiological booth with an audiologist and to get a real, honest-to-goodness hearing test. That's kind of the gold standard for if you really suspect that someone's got hearing loss.
So at Premier Medical, you have audiologists on site, on staff?
Yes.
Okay.
5 days a week.
Okay.
And they are a wonderful part of our family.
What are your recommendations for protecting your hearing?
So obviously, loud noise is the biggest thing you worry about for day-to-day activities. Concerts, lawnmowers, leaf blowers, rifles, shotguns, all those things can damage your hearing even if you're in a factory and there's a lot of background noise. The biggest thing would be to block the sound that's causing the hearing loss, or that can cause the hearing loss, really, if it's such a high intensity. And there are a lot of different types of ear protection out there. There are ear muffs, there are ear plugs. You got to be careful with some of the earplugs because you can actually push wax down in your ear, obviously. But some of the newer things out there are these hearing devices that fit in the ear and they kind of filter out the loud noise. For example, if you hunt, if you're shooting, and a lot of people, hunters, complain, well, I can't hear anything. I can't hear the dogs. I can't hear if I'm walking near a rattlesnake. But these new devices, you can actually you talk like you're normally talking and hear everything. But as soon as you fire the weapon or fire the shotgun, this device senses it and closes and it prevents the ear from getting the full blast of the sound. You mentioned concerts. Well, obviously, if you're standing close to the speaker,
you're there for the music, though.
Right, you're there for the music, but if you're standing close to the speaker, your ears may have some ringing. Let's talk about that just for a second.
I was just about to ask, what is this? I mean, I've had my ears ring. What is that?
That's the cochlea saying it's not happy.
Oh.
That's like you getting punched in your arm 100 times going, stop doing this, stop doing this. And it can sometimes cause something called a temporary threshold shift, where if you've been to a concert and your ears are ringing a lot after exposure to loud music, that's the cochlea saying, I'm not happy, don't do that again. Over time, that will damage the inner part of the cochlea and cause hearing loss. Now and then, there are also people that have hearing loss and they're coming in complaining, my ears won't quit ringing. My ears won't quit ringing. Why are my ears ringing? And that is a sign also of some hearing loss as well, or it can be associated with some hearing loss, really. So people that come in and complain they have ringing in their ears, we always test them.
So we talked earlier about how cochlear implants have changed lives, and now how technology has really changed hearing aids. It's amazing to see how biology and technology have come together to improve quality of life overall.
Yeah, it really is. That's the same throughout medicine. One of the things we were talking about, the stigma of wearing hearing aids, is I did have a patient the other day was telling me, and they were older, they were saying, look, I feel like I'm the $6 million man between the glasses that I'm wearing now and the hearing aids that I'm wearing now. I have to, take all this stuff off and put all this stuff on to kind of get through the day. And they did have a point. You don't want to feel like you've got all this artificial stuff on there, but easy things that improve your quality of life, a pair of glasses to help you see better and some hearing aids to help you hear better, it really can make a difference. And, you don't even think about it, but when you pick up a menu and you can't see, or, you can't hear somebody calling your name, those things make a difference. And certainly being able to see and be able to hear, those are your sense of sight and your sense of your hearing. Those are the most valuable things that human beings have to be able to communicate. Being able to help someone hear and being able to help someone see, although the ophthalmologists primarily are the ones that are taking care of the people with eye problems in our group. That really is why we want to, get up in the morning and try to help somebody. So those are the really basic things.
Well, thank you, Dr. Swain. So if anyone listening wants to come see you, how do they do that?
The easiest way is to call the office at 251-473-1900 or 251-633-2667. The other ways are through the web. We've got multiple options there. The easiest way probably is through the Premier Medical website at Premier Medical GRP. That's premiermedicalgrp.com. You can also use mobileentdoctordr.com. There are links in the Swain Sinus Show that can get people the right place. And also there is Ron, R-O-N Swain, S-W-A-I-N Jr.com.
Great. Thank you so much.
Thank you.
Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.